Hi, my name is Chloe with Autism Behavior Services Incorporated. Thank you for your interest in ABSI's premier ABA services. I have the pleasure of walking you through our intake process. Now let's get started on your journey to accessing ABA. If you are a parent or legal guardian of a person with an Autism Spectrum Disorder diagnosis or suspect that your loved one may have ASD, the first step is determining if you have a confirmed diagnosis of ASD. But how will you know? A medical diagnosis will come from a medical provider such as a physician or clinical psychologist. There will be a report provided to you with an explanation of ASD as it relates to your loved one. If you do not have said report, then you will need to make an appointment with your primary care provider and request a diagnostic evaluation of your son or daughter for ASD. If the primary care provider cannot complete the diagnostic evaluation, then you will need to request a referral to someone who can. Once you have been provided a formal diagnosis of ASD, you may request that your medical provider make a referral for ABA to your health insurance plan or make a recommendation for ABA in the diagnostic report. What if you are a parent or legal guardian and aren't quite sure whether your loved one is showing signs of ASD and need a diagnostic evaluation? Here are some initial things to consider. ASD is a spectrum disorder, which symptoms range from mild to severe. ASD affects all areas of development, such as language and communication, social emotional skills, fine motor skills, daily living skills, and play skills. With gross motor skills generally falling within the typical range, ASD is often thought of in terms of behavioral excesses and behavioral skills deficits. Excesses and skill deficits meaning out of range for someone of your loved one's chronological age. They are either doing too much of something or not enough of something else. For example, excesses can be tantrum behavior, aggression towards self or others, and stereotyped behavior. What is stereotyped behavior? These are behaviors that manifest as restrictive and repetitive behaviors that interfere with your son or daughter's day-to-day functioning. Some examples you may see are body rocking, hand flapping, tiptoe walking, lining up of objects, looking at parts of objects through the corner of their eyes, repeating words or phrases they have heard, or repeating what you say. Behavioral skill deficits are those behaviors they are not doing enough of for their chronological age. Some examples are they are not making adequate eye contact or responding to their name when they are called. Perhaps they are not yet talking, or maybe they are not speaking enough. They do not communicate their needs or wants verbally or non-verbally. They do not play with toys as they are tended, and they show little to no interest in their peer group. With ASD, because it is a spectrum disorder, no two individuals are going to present the same. In addition, just because a person has an ASD diagnosis does not mean they are cognitively affected. Many individuals with ASD fall within the average range or higher for cognition. Here are some additional developmental items you may want to consider. By 6 months, they start to become aware of their surroundings and look at things nearby. They begin to bring items to their mouths, becomes curious about things in their environment and reaches for items further away, begins to pass things back and forth from one hand to the other. By age 1, they are looking at the right picture or thing when it's named, imitating gestures from people nearby, starts to use things correctly, for example, drinking from a cup or brushing their hair, puts things in and takes things out of a container, follows simple instructions like pick up the toy. By 18 months, they can identify common items such as a telephone, hairbrush, or spoon, points to get the attention of others, shows interest in a doll or animal, can identify body parts by pointing, scribbles their own name or scribbles on their own, can follow one-step verbal instructions like sit down or come here. By age 2, they begin to sort shapes and colors, can complete sentences and rhymes in familiar books, play simple make-believe games, builds toys such as towers of 4 or more blocks. They can follow 2-step instructions such as pick up your shoes and put them in the closet. They start to name items in a picture book such as a cat, bird, or dog. By age 3, they can work toys with buttons, levers, and moving parts. They play make-believe with dolls, animals, and people. They do puzzles with 3 or 4 pieces. Understands what 2 means. They can copy a circle with pencil or crayon. Turns book pages one at a time. And can build towers of more than 6 blocks. Screws and unscrews jar lids or turns a door handle. Age 4, they start to name some colors and numbers, understand the idea of counting, start to understand time, remembers parts of a story, understands the idea of same and different, start to copy some capital letters, understands and plays board or card games, tells you what they think will happen next in a story. By age 5, they count to 10 or more things, can draw a person with at least 6 body parts, copies and prints some letters or numbers, copies and draws shapes, knows about things used every day like money and food. When considering these milestones, it is important to remember that the symptoms of ASD must appear prior to the age of 3. So now that you have a medical diagnosis, what do you do next? You will want to contact your health insurance plan and ask whether your plan covers the Applied Behavior Analysis benefit. If yes, then you will want to ask for a list of in-network providers and begin calling those providers to confirm they are in-network for your health insurance plan. Once confirmed, at our agency, we will request a copy of your health insurance card and a copy of the Autism Diagnostic Report, which is required for most health insurance plans. There is one exception to this rule, and we will address that exception in a moment. We will contact your insurance to verify your benefits and share that information with you. Once we have verification of benefits, we will request for an authorization to conduct an assessment. This assessment is called a Functional Behavioral Assessment, or FBA. The assessment can take up to 60 days to complete, but here at ABSI, we strive to get them completed within 30 days. Once the authorization is received from the health insurance plan, one of our clinicians will reach out to you to begin the FBA process. Upon completion of the FBA, the clinician will review the results of the assessment with you and further request an authorization for direct services. These services can include one-to-one direct applied behavior analysis for a number of hours per week, program supervision, parent education and training, and/or social skills group. Let's address the exception to the ASD diagnosis rule for most health insurance plans. Now let us review some of the points made. What does in-network mean? Being in network with your insurance means that your insurance and our company have a contractual agreement to work together to provide services for your child. If we are not in network with your insurance, sometimes insurance companies have other insurance companies who handle the behavioral health portion. You can contact your insurance to find out who handles the behavioral health for your insurance. And if it is a company we are in network with, we can move forward. If you have commercial insurance, we will ask you to send us a copy of your insurance card front and back, along with a copy of your child's diagnosis. Once we receive these documents, we will submit them to your insurance company, requesting an authorization to start the assessment. Once we receive the authorization to start the assessment, one of our supervisors will call you and make an appointment to get started. Medi-Cal, Medicaid may not require a formal diagnosis of ASD to access applied behavior analysis services. You will want to do the following. If you have Medi-Cal or Medicaid insurance that requires a doctor's referral, you will just need to call your child's doctor and ask them to send a referral to your insurance requesting ABA services. Once the insurance approves this request, they will then send the authorization directly to us. They should send you a confirmation letter as well. Our intake coordinator will then contact you and let you know we have received the authorization to get started. If you are accessing the ABA services through Medi-Cal or Medicaid insurance, a diagnosis of ASD is not required. For example, in California, in order to access ABA benefits through Medi-Cal, a diagnosis of ABA is not required. This process, from initial call made by you, the parent or legal guardian, to receiving the required documentation, verification of benefits, and authorization of the initial assessment, can take 2 to 3 weeks. This will be contingent upon how quickly we receive the information we need and whether or not we have a waitlist in your area to start the assessment. A few other questions we ask during the intake process will include: your name, address, phone number, and email address, what your top 3 concerns are for looking into ABA, your child's availability for services Monday through Saturday. Has your child ever received ABA services in the past, and if so, how long ago? Why did you stop? Are you comfortable with in-home and/or telehealth services? If you have any questions or would like to speak to one of our exceptional team members about our intake process, please give us a call at 855-581-0100.